All right, welcome Julio to the Dental Hygiene Basics podcast. So excited to have you on today and to share your dental hygiene origin story, which is going to be a great one because you are my first guest on the podcast who has not actually been accepted, at least that I know of, into dental hygiene school
Yeah,
yet. Yeah, you're on the
correct.
journey. So, Julio, tell me a little bit about yourself and kind of just fill us in on all the things you've been up to.
Well, thank you so much for having me. I'm so excited because I know I've seen you on Instagram and I've seen all the great work you have done. And I'm like, oh my gosh, she's so great. So thank you for having me and, allowing me to tell my story. So, yes, my name is Julio Cesar. For those who don't know me, I'm known as Julio the Future Hygienist on social media. And yeah, you're so absolutely correct. So, what made me kind of jump in to this was because I don't see a lot of the prereq journey or like how to get to that point. I know I would like look up on TikTok like how to become a dental hygienist. What do I need to become a dental hygienist, And so that motivated me to kind of jump in and get it rolling. I know it's scary because, as you know, social media can be a scary place. But I said, you know what? If I was out there curious to see what this journey was, I know there's a lot of more people out there. And so, yeah, that's what made me start this whole entire journey. So, yeah, you're right. I haven't got accepted yet. I'm in my last fourth semester of my prereqs. I'm almost there. Have two classes left, and then we're off to dental hygiene school. But yeah, for now, I'm a current RDAEF2. So if you're not familiar with that, Dana, it's like basically a registered dental assistant in expanded functions level 2. And we're allowed to do a lot of like procedures that a dentist can do here in California.
I love that. Yeah, we were chatting a little bit before we hit record, and I said, I need to know what you do because in Texas, where I live, we don't have expanded function hygienists, at least not to the level that you're able to do in California. So, what are some things that you can do that make your role as an expanded function assistant special?
Okay, so we can fabricate, contour, final restorations, whether that's like a composite or amalgam. We're trained to do both when you're going through the program. You are allowed to pack gingival cord. You're allowed to take final, indirect, and direct impressions for the dentist. So, meaning like for crowns, dentures, we can do bridges, we can seal root canals. You know, when like you go and seal the root canals with gutta persia, which I don't like to do. I always respectfully decline because that's a little bit like more on the scary end. I don't know. I just felt like in the program, I always said to myself, like, this is a little bit nerve wracking. So I might need more experience to feel comfortable doing this. And my dentist, he totally understands. But there's probably going to be a day where he's going to be like, Julio, I need you to go in there because I need to go somewhere else, please. And I'm not ready for that day. But yeah, we can do a lot of stuff. Like right now in my office, I also design and fabricate like zirconia crowns from start to finish. Like there's just a lot of stuff to do. But mainly what they use me for is the fillings, the restorative work. And because, like I said, a lot of people don't know how this works, but basically we take the load off the dentist. So they'll go in there, they will numb the patient for us, they'll open, like drill, do all the drilling, all the good stuff. And then we go in there and we finish the filling and take over and do the rest of the work so they can go and do an exam or jump over to the next patient. So that's how it kind of works.
I love that. And then do they have to come back and check the work before the patient's dismissed?
So that's a great question. So in the beginning, when you are a first RDAEF2, that does happen. So just depending on the dentist, but yes, they would like to see the x-ray after or just at least the x-ray. Some dentists will go back and check, but once you get to the level where you have like that trust, the dentist doesn't even do that anymore. It's like, for example, for me, he knows how I work, he knows what I do and what I'm capable of. And if I know that I make a mistake, he knows that I go get him and say, like, hey, doctor, like, I don't feel like this contact is closed enough. So can you go back in there and open it so I can redo it? Having that trust and communication, he knows. And so I'm to that point where they don't do that with me anymore. I know what to look out for. I've been in the dental field for 13 years, and luckily, I've had the best mentors where they know and they show me what to look out for. So thankfully, that's how it usually works. But yes, they will check.
Yeah, wonderful. And, the way I think about expanded functions, it's a beautiful model as long as we're all expanding our functions, right? And that's where I really think in dental hygiene, we need to see a boost of that, the rise in the autonomy, allowing us to do more procedures and have more of that provider standpoint. And then I still think it's amazing for assistants to have expanded functions and to rise and to grow because as you've said, you are directly supporting the doctor so that the doctor can practice to their highest level of scope, right? And then that means that we can take care of more patients. So I love what you're doing and I love your passion behind it. I can really see
Thank
your
you.
passion. And after 13 years in the dental field, sometimes that can wane a little bit, but you're just like driving forward, which is incredible. So I want to go back, maybe 13 years ago to Julio then.
Yeah.
What got you started in all of this?
Okay, so there's two versions. So first version is I grew up Hispanic, not just because this is a race thing or nothing, because my parents were great, but we were always cutting it short. They would, try the best they can do to support us. So they would be working a lot constantly. Honestly, like dental visits were not really a thing unless I was in pain. And this is what I'm trying to get at with like in today's world, like a lot of people tend to neglect the dentist until it's too late or until something hurts. And so for me, I was just like, oh, I never even knew what a dental visit was until I was like maybe eighth grade, ninth grade. And I started noticing, like, oh my gosh, like my breath started smelling, like halitosis. It was a thing. And I was like, how can I get rid of this? Back then, there wasn't even social media yet. You couldn't look up how to take care of this stuff. So I asked and I said, hey, I have this problem. What can I do? And so my parents were like, oh my gosh, I'm so sorry. Like, yeah, let's get you to the dental office. So my first dental visit, luckily I had no cavities, but I definitely needed a cleaning. And I totally forgot her name. And it like irks me till this day because she was the big decision in my life where I feel like everything happens for a reason. Everyone has a calling, but I feel like when I had that dental visit, I was like amazed. I said, oh my gosh, I think I can see myself doing this for the rest of my life. So I started asking and I was like, how did you get to this point? What is your role? And, imagine me as a 16-year-old, a little yapper. And she was just like, oh my gosh, like this kid is so interested. And she kind of told me just vague and, this is what I had to do. This is what I do. So that was that. Then we just kept going. That kind of like brushed off a little bit, it faded off. As soon as I graduated high school, I was like, okay, what do I need to do? I wasn't as good as I was now in school. I just probably wasn't trying enough because I could have been, right? But the lack of like also like, my parents not really showing me like, okay, this is what you do college. Like again, I love my parents. I really do. But just like sometimes that little push could have been needed. But again, I am so grateful and thankful where I am today. And I found my way. What's like I said, and I tell everybody, Dana, like what's meant for you will always be for you. No one can take that away. So I said, let's do like the RDA. Let's do RDA program. My college offered the RDA program from start to finish. They were gonna guide you through boards, all that. So I said, let's do that. I applied, I got in, and that's how I started working as an RDA for about 8 years. And then the RDA EF2 program came into my lap. It fell into my lap. My doctor was like, hey, Julio, I think I would be really interested in having an EF2 and they're offering this program from LA like on the weekends. What do you think? And I said, let's do it. I'm always down to elevate my experience and my education, like you said, right? And then I was like, okay, maybe the hygiene is still there, like the itch is still there, but like maybe not right now. I'm not in the right state of mind in my life. And so, I graduated as the EF2, started doing that for 3 years. But 2 years ago, I decided, okay, let's go back to dental hygiene. I'm ready. I'm ready.
I love it. A couple of things that you said, one thing is something similar that I've heard too. It's, what is meant for me will never pass me by. There's a time frame sometimes that we don't understand what the time frame is. Yes, wouldn't it have been amazing for you to graduate high school, get right into dental hygiene school, and have been doing this for 13 years? Like, yeah, sure, that would have been great. But look at all of the things that you have done in that time period. And really, when you get into dental hygiene school, not saying it'll be easy, but I just think about the amount of knowledge that you have already and then that passion, like you feel it, you know where you want to go next. That's how I felt, right? I felt the exact same. I was so excited when I got in and I was like, this is where I'm putting my energy in. Taking that time to really think about how do I want to elevate? And I've mentioned this before, but elevation doesn't have to mean like your next step could be dental school. It could not. You could be so happy as a dental hygienist and continue to rise within the field of dental hygiene. As long as you're continually putting yourself out there, seeking opportunities, learning, growing, you're going to continue to find love in your career. And I really think that's
Mhm.
important
So
throughout a time where people are struggling with burnout. And this is not just in dental hygiene. If you ask
yeah,
any of
everywhere.
your friends, they're like, I'm burnout. But we see it a lot in dental hygiene. So I would love to know, thinking through, you have this passion. I know you've seen probably some of the scary stuff on socials, the hygienists who are like, don't do it, go be a nurse instead. How have you navigated through those waters as someone who is now on the path towards dental hygiene?
So, for example, a lot of the negativity, especially like early last year, right, where we were going through like the assistants being able to scale, right? A lot of pre dental hygiene students kind of wrote on my lives. I would do TikTok lives and they'd be like, oh my God, what am I going to do? Like, is this true? Should I even go into dental hygiene? Like, should I not even waste my time? Like, everybody freaking out.
Yeah.
And I feel like we need more positivity and more hygienists out there to encourage that because at the end of the day, I feel like we will never be replaced. Sometimes we might get our wages cut down lower because like assistants could be able to do it because sorry, Tina. But there's going to be a lot of assistants that are going to be, like able to scale. And then maybe our wages will be lowered because now they don't need us as much. So I feel like with me, I always want to be a light in this world. I always want to encourage because if I were to see that, I'm the type of personality that it's like, I'm not wasting my time. Seeing that stuff and that negativity is just not encouraging. And it's like, I'm just like, I'm not going to do that. Like, I feel so bummed. I'm not going to even go there. But again, there's people like us, you, like that doing all these podcasts and doing all this social media that to encourage people. Like, it's amazing because they need that.
Yeah, absolutely. And I think you are in the driver's seat of your own destiny. Thinking through, there have been times where I've had highs and lows in my career, and I recognize that I was the one that was in control of what I was going to do next, how I was going to progress and move forward. And I really just think that if you have a passion for something and you want it to happen, it will happen in your life. And if you continue to seek out those things, make improvements, it's just going to keep getting better. And I always just tell people you can't take away your education. So even if you go through the school, okay, so let's say you get paid $5 less an hour. If you love it and you're passionate about it, really it's not going to matter. I've taken significant pay cuts, like $20 an hour pay cuts to
I
go
bet.
into education, and you couldn't pay me to go back the other direction. You know what I mean? So it's one of those things where there's a give and a take with everything. And I understand having fear around like your profession that you want and love, but if you love it enough, you're going to do it anyways, right?
Exactly.
And you're going
Exactly.
to be successful.
So that's a great way to put it because at the end of the day, dental has been my passion. So at the end of the day, I'm going to continue to do it, whether like we'll see in the future what happens with the dental hygiene profession. But like you're correct. But I just truly don't see the dental hygienist going anywhere. I really don't.
I don't either. And really, I think we're at a tipping point in our profession. Hygienists are really banding together, informing, educating the public. Today, actually, although when this is recorded, it will be in the past, but today there are hygienists, doing a peaceful demonstration in Washington, D.C. right now to educate people and legislators about what we do. Yeah. So the thing is, there's a ton of passionate hygienists out there who are not going to let our profession die. Right. And what I
Exactly.
think too is if you have assistants who are trained to scale, who's going to be training them? The dentist does not have time for that, right?
Exactly.
It's
What I told my dentist right now, I was like, "Do you want to train these assistants to scale?" He's like, "No." Even like that's not my deal.
Yeah. And then, like, okay, well, fine. Let's push as hygienists to be able to own schools, practices, whatever, to train assistants to do this, right? Like,
Right.
let's take control of the situation and make sure that these people are educated to the highest standard that we can, right? So that they're not out there on their own, one, feeling uncomfortable, not confident, I mean, you're not in dental hygiene school yet, but when you graduate, you're not even gonna feel confident yet, you know?
It's exactly that.
Yeah,
It
yeah.
comes with time. It's gonna come with like experience. You
Yes.
like yes, dental hygiene school is probably gonna teach you like the basics and the books, right? But it does not compare to actual hands-on,
Yes.
experience, right?
Yes, and yeah, the more experience, just the better it gets, and, I don't even think twice about some things now, probably like you know, like the
Yeah,
tongue, you're
like
like,
we
"I
could do
just manage the tongue."
like you blindfold me, I can probably do that filling.
Yeah.
It's just it comes with experience.
Yes, absolutely. Well, tell me a little bit, you mentioned that you went through the program, the dental assisting program. Are you comfortable sharing where you went to school for that?
Yeah, of course. I went to a local community college. It's known as Allen Hancock College. And so I love that they have this RDA program. It's just we don't have any dental hygiene schools around us, right?
Yeah.
The closest hygiene school is like 50-minute drive. And then there's another closer one, like I say, what, 45 minutes, like east, like going towards like Fresno area. So it's a blessing and a curse, okay? Because I talked to all these hygienists that I work with. They said, Julio, don't you even dare put it out there for us to get a hygiene school here because then the demand is low.
The market will be saturated, and
Yes.
so
Just
it'll
like,
be
where am
harder
I
to find
going?
a job.
Because right now in our area, it's so hard to find dental hygienists. Like, dentists are willing to pay big bucks just for a dental hygienist. So, like, I guess that's the pros and cons, but like at the end of the day, like I've always said, I'm not doing this for the money either. Like, of course, it's a great benefit, right?
Yeah.
But like at the end of the day, I want to elevate my skills for my patients. Coming back to the my home office and be like, now I can do your filling and I can numb you without having to have the doctor here. Like, or it's like I could just, do your deep cleaning and like I know what to look out for. If this filling doesn't look good, maybe let me go polish it for you. It's gonna be great.
Yes. And hearing you say that, it's really exciting for me to think about you as a hygienist with these expanded functions as an assistant, how you can merge those two together and provide even better care, you know?
There's a lot of hygienists currently in my office that they'll come get us like, hey, I don't know what to do with this. There's this filling here or this, that, or can you polish it or can you do this? So they have to wait for the dentist or someone else to go in there and I won't have to have my patients wait anymore. It's
Yes,
a good thing.
yeah,
It's
it
just like
is.
you said before, expanding our skills so that we can provide better care for these patients.
Yes, exactly. Julio, I love this conversation so much, and I can already tell we're going to yap a little bit longer. So I'm going to go ahead and put a pause, and we're going to do a part one and a part two episode. So I'm going to
Okay.
pause, and we'll wrap this up in our next week's episode.